Now, if we fast forward to the hamstrings, and let's talk about them for hip extension, because the hamstrings, 3 of the 4 muscles cross 2 joints, so we need to differentiate their actions. The semitendinosus, the semimembranosus are the 2 muscles that are medial, so they're on the insides of the femur, on the posterior aspect. The biceps femoris long head is what is on the lateral. Now, there's also biceps femoris short head, but it does not cross the hip. Now, how does this cross the hip? Well, these muscles start at the ischial tuberosity. Now, the ischial tuberosity, as we'll see here in a minute, is on the bottom of the pelvis. And this is actually what you're sitting on right now. You're not actually sitting on your butt on musculature. You could cause ischemia. But we're instead sitting on bone, and this is just far safer. Medially, where do they insert at? The semitendinosus and semimembranosus insert into the medial tibia, down to the pes anserine region. And the lateral insertion for the biceps femoris long head is along the lateral tibia and really mostly on the fibular head. Now, here we see the origin and insertion. And looking at this, here is the iliac crest. Here is a foramen, here is the greater trochanter, and here's the femoral head going into the acetabulum. We see that we've got the biceps femoris being lateral, and we see the semimembranosus and semitendinosus being more medial, and they come from this point off of the ischial tuberosity. Okay. Looking up more closely, again, here we can see the origin. Here we see the quadratus femoris, which is an external rotator. We see the origins of the hamstring muscles. Again, this is the biceps femoris. This will be the semitendinosus and semimembranosus. These muscles over here are the collectively the adductor group, and we see a gracilis and sartorius over here as we go more medially and anteriorly. So exercises for the hamstrings dealing with hip extension. Of course, they're going to be a lot the same as the glute, right? Because we've got doing the same function of hip extension. We're driving the hip back. And again, this is not an exhaustive list. But Romanian deadlifts, good mornings, glute bridges, and then glute ham raises included. And the reason why glute ham raise is included is because often people will include this as a hip extension exercise and a knee flexion exercise, both. The downside to this is that it depends on the method of which that you perform the lift. To have it count as both a hip extension and knee flexion exercise, you'll have to start out with the torso pretty much vertical and the body, the head towards the ground. Come up into the midpoint position to where you are parallel to the ground with your chest and your thoracic cavity. Pause for a 2 count, and then begin the movement that everybody already does for glute ham raise of pointing the toes, trying to push them through the platform, squeeze the glutes, engage the hamstrings to pull yourself up. Whenever you combine the 2 movements into one, then it does work as a hip extensor and a knee flexor because you have the hip extension through the back extension portion. If you aren't performing the movement like that, you are not getting the hip extension in addition to the knee flexion. I bring that up and I talk about it so long because so many people say, hey, glute ham raise is hip extension and knee flexion. Well, it only is if you perform it in that one certain manner. Most people do not perform it in that manner, which would mean that it is not a hip extension exercise, only knee flexion. Now let's get to knee flexion. We've got all 4 muscles here. Semitendinosus, semimembranosus, biceps femoris long head, and short head. Now the origin didn't change for 3 of the 4 muscles. They're still coming off of the ischial tuberosity. The biceps femoris short head, however, is coming off the linea aspera, which is simply a line that is existing on the posterior aspect of the femur. It goes down and it inserts into that lateral fibular, the fibular head and lateral tibia. And again, the pes anserine is the insertion point for the medial hamstring muscles. And what do? It's simply they flex the knee. Now, if we look at the total hamstring again, we remember that we can see that we've got the semitendinosus, semimembranosus here medially, and you can see how the semitendinosus goes on top of the semimembranosus. And then the biceps femoris, long head here. The short head starts at the linea aspera, right around in here, comes down, wraps around. It is deep to the biceps femoris long head, so it's tough to see. Now, if we look on the medial insertion point, we've cut away gracilis, artorius, etc. We see adductor magnus, which is a pretty interesting muscle. They actually say that the adductor magnus has a hamstring portion because its line of pull will allow for extension. And the adductor magnus also co-contracts with the glute. We saw the fiber orientation and how it could cause abduction and external rotation. Well, the adductor magnus co-contracts with the gluteus maximus, and it prevents that abduction and external rotation and allows for the glute to cause more hip extension instead. Now, we look down here and we see the insertion for the semimembranosus and semitendinosus. Okay, tendinosus is on top. We see that they go down, and it's not just directly posterior, it's lateral and slightly anterior even. And this is going to be important for whenever we talk about posterior tibial translation. So I want you to remember how these insert. That it's not directly in the back, which would be more efficient for knee flexion, but it's to the side and even slightly to the front. Now, if we look at the lateral insertion point, again, we're to the side and maybe even slightly to the front with how it inserts into the fibular head. In open chain, it will flex the knee or it will prevent knee extension. Think about with sprinting, how you don't want the shin to slide out forward. So that would be a eccentric or possibly even an isometric contraction. We'll talk about that shortly. Closed chain, whenever the foot is planted and the hamstring muscles turn on as a knee flexor, they're doing posterior tibial translation, meaning that they are taking the tibia and pulling it back. Now, this is important because of the explanation of the implication of anterior tibial translation and ACL tears. If the hamstrings are weak, they are unable to posteriorly translate the tibia, especially under fatigue, and the ACL goes along with the anterior tibial translation. Now, in sport, hip extension is our primary hip propulsor. Okay, it is what we utilize most in running and jumping. You see a super fast person in college, you typically see they got a big butt and they might have an arch in the for the hamstrings that they go out and they make a muscle. Why? Well, because hip extension is that important for propulsive forces. With a weak hip extension, you're not going anywhere. With a weak knee flexion, you're at a greater risk of being injured. So some exercises. Again, I put the glute ham raise on here because regardless if you do the back extension that partners with it to make it both hip extension and knee flexion or not, you're still going to get knee flexion out of it. Of course, the Nordic hamstring curl, that has come of popularity as of late. Our leg curl and a razor curl, which is a dressed down version of the Nordic hamstring curl for those who can't perform it. I do want to take a little side note here. With the Nordic hamstring curl, it has been almost a buzzword in the past several years. Some people will talk about it being the new exercise that cures all, and I will disagree with that. It's not some magical sprinkled with fairy dust exercise. But some have looked at its efficacy for hamstring strain and ACL tear, and I've provided some publications down in the reference list. There's a mixed bag on it. There's a mixed bag for a few reasons. We've got to realize, when do hamstring strains occur? If you look at various people, some will say that it is occurring during the eccentric phase where the knee has driven up by the hip flexors and rectus femoris, and the shin is starting to accelerate forwards, or the tibia swinging forward. Then it would be the shin. Those muscles turn on. Now, is it slack or is it a strain due to the sliding filament theory? Well, this confounds the argument. As well, you can see in the references, Bas van Hoorn and Frans Bosch are proposing this muscle slack, where essentially the muscle is under an isometric contraction and it's trying to hold on, rather than the sliding filament theory and causing a lengthening. Who is right? We don't know yet. We don't know yet, simply put. For the ACL tear and its efficacy, the hamstrings are posterior translators of the tibia, and they do help with tibial control. Now, why do I keep going back to this over and over and over again? Well, there's three main mechanisms to ACL tears: hip adduction, hip internal rotation, and tibial anterior translation. So if we can prevent one of those massive risk factors for an ACL tear, we're going to be far better off with our athletes. So it's something that's going to help out and keep us healthy and wealthy and wise, because we've got all the players on the field. So it may be efficacious for the prevention of the tibial translation anteriorly, because it strengthens the posterior tibial translators of the hamstrings.